she brings her arm back up. While we're up here, we're going to look at the palm of her hands and look for the creases, and we're mainly paying attention to see if there's a single palmar crease, which sometimes is indicative, of Down syndrome. We're going to make sure she has all 5 fingers here and here, and we're also going to look for webbing in between the fingers. So next, we're going to go to the feet and assess for creases as well as digits. Put our cap back on to keep her warm. So we just look here at the crease of the foot here and see how many creases you see. Sometimes it'll be all over the foot, other times it'll be a third of the foot, and that can be indicative of gestational age, depending upon how many creases there are. We're also going to look at the toes, make sure there's 5 on each foot, and look for webbing as well. And we're also going to do the Babinski reflex, which you can take the tip of your finger here, start at the heel, go all the way around the lateral foot, across the sole of the foot here where the pad here, to the end of the foot, and the toes should spread apart. Turn baby to her tummy gently, and we're going to assess her spine, making sure it's straight. We're also going to pay close attention to the gluteal cleft here, looking for any tuft of hair, dimple, which is not normal. We're also going to look here to make sure the hips are symmetrical, and to do that we can just look and see, assess for the gluteal smile here, kind of like a little W. Reattach her diaper here, turn her over gently, and wrap her back up to keep her warm. Next, we're going to check for the Moro reflex. To do that, I'm just going to hit the crib mattress or bed here, and the baby should react by adducting and abducting back, or making a C shape with her fingers. And also, just throughout the assessment, we need to assess for the baby's behavior. Was she awake? Was she sleeping? Was baby crying a lot? Non-responsive? Was she rooting, etc.? You also can weigh the baby, and you do that. The baby would be naked, but you do not chart that. You can just write it down for your paperwork. And also we want to know when the last void was in stool and when the last time the baby ate was. And breastfed babies should be fed about every 1 to 3 hours, and formula babies should be fed about every 2 to 4 hours.